Hello, welcome to AutoNAD. I'm Dr. Yash. This is the MRI of the hand. The patient had a ruptured tendon of the fifth digit, but they have this entity, which is avascular necrosis or Kienbock disease, or some people call it lunate Malaysia. But it is abnormal blood supply to the lunate bone, and it gets weak and also collapse slowly, deform over time. This is lunate bone over here. So this is scaphoid, lunate, tracheotomy. There's a distal radius. A lot of time we see lunate and Malaysia associated with ulnar negative variance, and that is when ulna is short relative to the radius. There's a little gap between the TFCC, fits into horizontally, and ulna is too short, and that will cause abnormal pressure between the radius and the lunate bone and lead to lunate Malaysia or Kienbock disease. We see capitate here is migrated proximally, but a little bit. We see this often when it's ruptured scaphoid lunate ligament, and the joint is widened here, and it can migrate down, and they may be partially torn, or it didn't look like it was ruptured, and it wasn't really wide, but we can't say there's a complete loss of joint spacing between the lunate. So the capitate bone and the lunate bone over here there's some darkness, which is reactive bone sclerosis, and throughout the lunate bone there's also few little bone erosions scattered around it, and just few joint space narrowing. I believe they have airway that's causing abnormal proximal wrist, and then there's abnormal stress between the capitate and the lunate, and there may be etiology for even there. We can see some reactive marrow within the capitate bone, some related changes, and that also could be seen with RA, and just proximal migration and chest basin area. And also here tracheotomy bone has similar marrow but the lunate bone has mostly, and that's low signal on other sequence, which is probably some reactive fibrolytic changes on top of the marrow but no, this time there's example of AVN of the lunate or Kienbock disease.